If we do 10 cesareans, 7 cesarean patients would come back with a cesarean wound open.
Seriously?
Another 5% they would be taking lifelong. If episiotomy is not causing this, what is causing that? We end up in the anal incontinence. These 3 things are taken care well, then they will not have back pain.
Once you have gestational diabetes, then there's a higher chance of diabetes later on.
Yes. The custom was till 1 month, they will be given only Rava Ganji.
Tell me about postpartum depression.
Throughout the pregnancy, the progesterone hormone is in full peak. Suddenly it dips. ऐसा कैसे हो सकते हैं? छोटा बच्चे को कैसे हैंडल करेंगे? At the time of delivery, how much blood loss has happened? First, most important thing is belt. You'll be getting very bad back pain.
How about the postpartum hair fall? Welcome to the very first episode of the Better Health Conversations. Today's guest is someone I'm truly excited to welcome, especially for women navigating the postpartum phase. Dr. Subrata Rangaswamy is an obstetrician and gynecologist with over a decade of experience supporting women through pregnancy, postpartum recovery, and long-term hormonal health. Her patients often speak about how safe and heard they feel with her. She is known for explaining the why behind the symptoms and the decisions in a calm and reassuring way. With experience in both routine and high-risk pregnancies and a strong focus on evidence-based preventive care, she brings much-needed clarity to a phase that can feel overwhelming. In today's conversation, we break down postpartum health in a simple, practical way. What's normal, what needs attention, and how to support your recovery long-term. Welcome, Dr. Subrata. Thank you for joining us today.
Welcome. Tell me, dear.
So let's start with the first step of postpartum. So everywhere we see on the internet that postpartum recovery beats C-section or normal delivery. 6 weeks is a good period.
Yeah.
But I did not feel at all recovered at 6 weeks. So what exactly is 6 weeks period, and why is it so popular on internet?
So 6 weeks period is very popular because what exactly happens in the pregnancy, the uterus would grow, which would grow up to the level of the epigastrium. So that grown uterus, the moment the baby is delivered, it comes up to the level of umbilicus. The uterus will be sitting like one big ball there down in the tummy, which is attached to the backbone. Okay, through a ligament called uterosacral ligaments. So that's why we always specify wearing the belt is very important. Whether it's a normal delivery or C-section, wearing the belt is very important. Why are they specifying about the 6 weeks is that big ball which is sitting there, which will come back to non-pregnant state in 6 weeks. Okay, it is not that the whole complete recovery will happen. No, the uterus will all come back to its completely normal state. Okay. And then not just that, then you will tell, yes, will not feel that recovered immediately after 6 weeks, and then no, but the muscles and the ligaments, everything, that will all little take time. So that is the reason we specify on 6 weeks. Especially wearing the belt for first 6 weeks is very important.
Okay. So after 6 weeks, is there anything that must be tested by a doctor or checked by a doctor to ensure that recovery is going good?
Yeah, so once the 6 weeks is over, if all the things are fine, no need immediate checkup. Generally we tell for coming for the checkup repeatedly after like 3 months or after 6 months. Okay. So if you are feeling that little delay in the recovery, see, most of them will recover by 6 weeks. Okay, the whole organs will become to normal pre-pregnant state by 6 weeks. But what all will delay this recovery? If the patient is having an anemia, yes, when the hemoglobin is too low, the recovery will be delayed. And some will have infections. Sometimes they'll have urinary tract infection, or sometimes wound infection, or sometimes a breast infection, that breast abscess, congestion, all those things. During that scenario, the recovery will be little delayed. Okay. So, and what checkup to be done at 3 months or 6 months is routine basic, your complete blood count, thyroid levels, your sugar levels, vitamin D, B12. These are the basic things which has to be tested.
Okay. So why these parameters go off track after pregnancy? I mean, in pregnancy we are told it's hormones. But then after pregnancy they should settle, right?
That is what we are going to check it, whether it is settled or not.
Okay.
So generally many a times there is as you know, many will get thyroid only in the pregnancy. Okay, but if it is very minimal increase in the TSH level, we would have added very little dose of thyronome, which we would tell to stop immediately. But if the TSH is very high, we cannot stop immediately after the delivery. Like if the patient is taking 100 mcg of the thyronome and immediately post delivery, we will not tell fatak se stop, because it will be very difficult, because baby also needs the thyroid hormone when the mother is like taking. So in that scenario, after 6, so at the moment the delivery has happened, from 100 mcg, we'll reduce the dose post delivery, and then after 6 weeks we will be repeating it, whether it is come back to normal or do we have to do any variation in the thyroid hormone. It's like that. Even vitamin D and B12, yes, there is very high chances that it can also drop. Why we will test is, if the levels of vitamin D and B12 is low, then the recovery will take late.
Got it.
Yeah, they'll feel like back pain and stuff and tiredness. They'll not be understanding. See, vitamin B12 deficiency, the major symptom is tiredness. They'll feel like, I just don't want to get up from the bed. That level of tiredness. But now we will not be able to differentiate. Post delivery, it will be like that mother will not be sleeping because of that lack of sleep. Whether the tiredness is because of that or this, we have to differentiate just for
Okay.
that sake.
So about the thyroid thing, so you mentioned that we tested and we do not drop the dosage, but then if thyroid is not coming in some cases, I know some friends who asked this question that since they did not have thyroid before, but since pregnancy, or I should say postpartum, their medicine has not stopped. They have like delivered 5 to 6 years back. So like why these abnormalities occur?
See, some patients, what happen when the thyroid levels is too high, which might have not picked up earlier, routinely they won't be doing the testing.
Okay.
Okay, during the pregnancy, yes, of course we do. So if that level is too high and we have started high dose and they would have prior only had a little component of it, which might have missed. And later it might continue, not everyone, but few percent of the people, whether it's a thyroid in pregnancy or hypertension in pregnancy or diabetes in pregnancy, 95% of the times, the moment the deliveries happen, it would get cleared. But another 5%, they would be taking lifelong. I have had patients who have had a hypertension in the pregnancy and later it didn't settle and all, and had to start on antihypertensives for lifetime. Even the diabetes in the similar way. So that all depends on person to person.
So coming to diabetes first, so gestational diabetes is again a very common thing. So like it's hormonal, right? When it happens, so I know few athletic friends also who got this thing. But it settled down, as you said.
Yeah.
But it is said that once you have gestational diabetes, then there's a higher chance of you getting diabetes later on.
Yes, that is very true. See, as I said, gestational diabetes is very common because we being Asian ethnicity, it's very common for us to get diabetes in the pregnancy. That's why we always tell from the starting of the pregnancy, it's better you think and eat. Just because pregnant ho gaya, chalo khao, sweet khao, should not eat like that. You have to be very mindful about eating. So to avoid only gestational diabetes, if you from the starting of the pregnancy, if you avoid unnecessary sweets, unnecessary junk, you will be avoiding GDM. Yes, but those who have got gestational diabetes, there is a high risk of getting them type 2 diabetes in later part of the life. Like what I'll tell you, if their mother or father, they would have got diabetes at 50 years.
Right.
And this particular patient, she had got gestational diabetes, she might get it 45 years. So she can prevent it by changing the lifestyle. She can push the number of years. It is not that you got diabetes, oh then pakka fix mujhe jaldi aa jayega. It's not like that. If she maintains a proper lifestyle with a workout and diet, then she will be postponing the number of years it could come.
And is this true for thyroid also? If we take care, then can we reduce the symptoms or at least manage it well?
So thyroid is not like diabetes. Thyroid is like, it's a different thing. Thyroid hormone should secrete the thyroid hormone. That is very important. Right. Our gland has to secrete it. So that we can try up to the level what all we tell to avoid, especially the cauliflower, cabbage, broccoli, that group of family we tell to avoid, especially for those who have thyroid. But it cannot be managed with the lifestyle. Thyroid is not just like that. Only these things you can avoid, but you have to get the thyroid tested, and you have, if there is any variation, you have to take the treatment.
Okay. With lower dosage we can
Lower
manage.
dosage we can manage, yes.
Okay. And lifestyle will not play any role in that.
Very less likely.
Very less likely.
But diabetes and hypertension major.
Okay.
A thyroid less likely.
Okay. And the last one that you said is hypertension. So how about that?
Hypertension is also pretty common in the pregnancy. Like that's why we tell there now a very good thing what we have. Earlier this was not there during our parents' generation. No, it was not there. During the NT scan, when we are doing a scan, we check the uterine artery pulsatility index. So it is little complicated. I'll tell you. We call it as uterine artery PI. What does that mean? When the uterus is there, uterus will get a blood flow from both the sides, uterine artery. Okay. In that uterine artery, how the blood flow is going will be checked on the NT scan. So depending on that, that will give us a risk assessment whether this patient is going to get hypertension in this pregnancy or not. If we find out there is a risk, then we start them with on ecosprin. Okay, how will this ecosprin work? So, and many people will be like, oh, you doctor, आपने मुझे ecosprin डाल दिया, ये तो मेरे पापा को देते थे. You are giving me why ecosprin? Patients will get panicked whenever we write ecosprin. So that's what we tell. See, if you just understand why ecosprin, when the uterus is there like this and the blood flow is going to the uterus, how the blood flow, whether it goes faster or slower, will be seen. So why ecosprin? It's like taking a water bottle. You take a water bottle, you fill a thick dal in it and open the cap and do like this. Will the dal come easily? No. It will think to come or not. So when the PI is high, andre, the blood flow to the uterus is going like that. So what will happen when we give the ecosprin? That thick dal will be converted into water. The blood will become thin. The blood flow easily goes. That prevents the risk of getting hypertension in the pregnancy, first point. Second point, it also prevents unnecessary FGR. See, when the blood flow is compromised, obviously the baby weight will go on lower side. So that will also be prevented. Okay. So this is one major advantage which we have, which we are helping out with the things. So, and yes, even we gave everything, some people will be next level resistance, they would have got hypertension in the pregnancy. That person, usually most of them, the moment they deliver, it would settle. But for some it will be little high, wherein 1 month we might have to, 15 days or 1 month we might have to give antihypertensives and then settle it. So those people who had hypertension in pregnancy, they are at a risk of getting hypertension in the later part of the life, pretty earlier, like a diabetes only.
Got it. That was a very nice explanation with dal and all. Nice.
Yeah, because you should understand, you should be knowing what exactly. Many will be thinking, why ecosprin, papa ko dete the, mujhe kyun de rahe itne kam umr mein. So you should be knowing why, what's happening.
Okay, now going back to the first question, the recovery part. So you mentioned about the uterus till where it goes and then it comes to umbilical. Now that is about the uterus thing.
Yes.
But still, especially even the weight that we gain. So obviously everything is not baby weight. Baby weight is the smallest part, I would say.
Yes, that's true.
But then there are other things. So blood volume also increases, and
yes.
Placenta, at least placenta will be out. Some amniotic fluid will be out. But when does all of these settle down when it comes to recovery?
So all these changes, whatever the blood volume which has increased, or the pulmonary capacity, and coming to your uterus, all these things will take 6 weeks only to recover. Okay. The overall muscle and overall strength, endurance, that will take 6 months.
Got it.
3 to 6 months. Okay.
That's what I felt. I felt like I was really weak after delivery. Even after 6 weeks also, I was pretty weak.
Pretty weak. Yes. That's why we very much importantly tell taking the supplements during that time is very, very important.
Correct. So supplement is again another very confusing thing. So like is it a standard thing that iron for this much period, calcium for this much period, or it is a case by case thing?
It's usually a case by case, because we at the time of delivery we see, so whether it's a normal delivery or a cesarean, at the time of delivery how much blood loss has happened. We need to recover that blood loss, and not just that during that period. So post delivery also we call it as lochia. Another 3 to 4 weeks, or sometimes even up to 6 weeks, they'll be bleeding. It will not be like continuous. One day it will come and again 2-3 days it will stop, and you would have thought no, nothing required, and again when you don't wear pads, suddenly bleeding will start. It will be on and off, on and off. So this much blood loss would have happened for so much time, plus blood loss during the delivery time. All these things has to be recovered, and you need to take iron supplements. That is very important. Okay. Now coming to the calcium supplementation, till you breastfeed, you have to take. That is very important. Why is it important? Yes, many people, as you were telling, so many people will attribute cesarean करने की वजह से I got a back pain, because the needle which they use that caused back pain. No, that is not at all true. Because yes, it could have been there during our parents' generation. That time the spinal needle used was pretty big. Okay, so that even the spinal needle pretty big which used, that will usually not cause the back pain, but for the people to correlate, I am telling. But now the size of the spinal needle is just some 3-4 hairs when we join. So thin, not even IV cannula size it will not be. So in that scenario, what happens? The spinal needle will not be causing, because it will be very thin, it will not cause. But what all causes the back pain? See, even those who go through normal delivery will have back pain. Okay, back pain is not leaving any one of them. But if they do these 3 main important things properly, they will not be getting the back pain. First most important thing is belt. As I was telling, wearing the belt for first 6 weeks is very important. Why is it important? As I was telling, the uterus is sitting like this, which is attached to the backbone, and it's like pulling. You stand up, you walk around, you do whatever, it keeps pulling. So in that scenario, you'll be getting very bad back pain. Okay, so whenever you wear the belt, you will get a support, except when you are sleeping or when you are eating, because you need to eat comfortably. Except for these 2 times, you should always wear belt for first 2 months, 6 weeks to 8 weeks. Okay, that is the first important point. Second, feeding position. I tell this very much importantly. I specify for all my patients. See, many people, not just the lower back pain, they'll end up with a trapezitis. Here the trapezius muscle will start paining. What happens? They'll tend to take the baby, bend like this and start feeding. No, that should never be done. Keep a pillow, one huge long pillow which supports your whole back, because from the spinal cord, from the neck to the lower tailbone, the whole bone should be supported. Like that they should sit. When they sit like that, and put one more pillow on the lap so that baby comes to height. So they'll be straight, comfortable, and they have to feed in that position. When they're doing the feeding in that position, the back pain chances will be very reduced. Why? Because as I said, feeding is not some 5 minutes job. Har 2 ghante mein half an hour you have to feed. So imagine in 24 hours how long you will be sitting. If you don't take care of the posture, obviously you'll get very bad back pain. And one more important thing, especially for the women who underwent normal delivery, what they do is, when they have a back pain, when they sit straightly like this, the stitches will hurt, Anta. They tend to sit like this, like the back will be lower curved. They tend to sit little forward so that they'll feel comfortable. The stitches will not hurt, but the back starts hurting. Stitches will not hurt if they sit in that position, but the back will get very bad posture. So that will be causing the pain. Okay, next. These 2 are the done. And the third most important thing. Yes. Why do we tell you to drink milk? दूध में क्या है?
Calcium.
What is the baby doing?
Developing right now.
No. What is the baby doing? Drinking the milk.
Yeah.
When the baby is drinking the milk, obviously आपकी body में कितना calcium है, सब कुछ baby को जा रहा है. If you don't take supplements by yourself, तुम्हारी हड्डियों से भी calcium निकाल के baby को आ जाएगा. When that comes, obviously baby is a parasite, whether it is inside or outside. उसको क्या क्या चाहिए रहता है, सब कुछ baby को मिलता है. But you would be compromised. So they'll get very bad back pain. If these three things are taken care well, then they will not have back pain.
Very well explained. So I have made two videos. I think one you have already seen, which you're pointing out that injection part. So before actually I was shocked because doctors, whenever they speak on internet, right, nobody will accept that it's because of spinal injection, and patients will just keep on complaining. So I did my thing. So I asked in that we have this Cloud9's Mama group. So there I did a poll, and I asked that who had normal delivery and has back pain, who has C-section and has back pain, and otherwise also you know, or maybe you don't have anything, maybe minor discomfort. So as you mentioned that maybe normal delivery, they will not have pain in the stitches, but they will get the back pain.
They will get pakka because they will sit in this abnormal posture.
And yes, that's true. Actually, there was not much difference between who got C-section and back pain and who got normal delivery and back pain. So it is actually not related to what was
Spinal
the mode
anesthesia.
of
Yes.
Absolutely. And other things which you mentioned, that trapezius muscle and
Muscle,
all,
yes.
so that is again true. I went to physiotherapist also because
Yeah,
I was getting
get
pain
very
here.
bad trapezitis.
Yeah.
Because you have to sit comfortably and feed the baby. That's very, very important.
And after that, I got this, feeding pillow and recliner. So that's whole back is supported, and that was that really helped. And so that was very helpful. Now coming to this supplement part. So firstly, let me ask you, how about the postpartum hair fall? Can anything be done for that?
So usually postpartum hair fall happens for everyone. We call it as a teinogen effluvium. So especially it peaks at the time of 3 months to 4 months, and it settles by 8 to 9 months. Okay, it is usually that is how it goes. So already we'll be giving your iron, calcium, all those things. Along with that, nutritious food. Diet matters a lot. If you take these things and be little relaxed, it's enough. No need of any additional things. If it's too much, only when the deficiency is seen, then we give biotin. Okay. Otherwise, generally biotin is not required. With the iron and calcium and a good nutrition and lots of water, on these things would be enough.
So you mentioned that calcium should be taken till the entire duration.
Feeding, yes.
Yeah, but there are few doctors who recommend that 3 months, 6 months, something like that. Maybe something case by case, I don't know. So in those cases also, I see because of postpartum hair fall, people they have the tendency ki, let me take iron and calcium for longer duration. So these are just vitamins, but I just want to understand that is it okay to self-medicate in this domain?
So it's, see, iron thing, yes, they have to 6 months if they have taken, it's enough. Or they can check because iron is very important when it comes to the hair fall. Because the moment you go to the dermatologist and tell that you're having a hair fall, first thing they'll get checked is your ferritin levels. Ferritin, vitamin B12, these things have to be checked. Okay. So if that is settling, or if when you get your complete blood count, if it's all normal, then you can stop it. Okay. Calcium, it's okay to take, but one most important thing people should keep in mind, calcium लेने के बाद properly पानी पीना है. If they don't take sufficient water, if they take only 1 liter of water, then sometimes there is a chances that it can form stones in the kidney. So they have to keep that in mind, and they have to take the calcium properly and drink lots of water.
Anything that we can get it checked for these kidney stones? How do we know that if that's not happening?
See, if the pain is there, generally they go get it done. Otherwise, routine USG abdomen and pelvis will pick up a bigger stones. Very minute stones cannot be picked up.
Okay. Okay, and how about omega-3?
Omega-3, it's a very good supplement that can be taken, no problem.
Okay. So, supplement wise, I think we are sorted,
problem,
not a big issue. Iron for, you're saying for 6 months, but
6 months.
rest is okay.
Depending on the hemoglobin.
Okay, so now tell me about postpartum depression. So, is it a hormonal thing, and how do we know that this is depression, or we are just exhausted, or maybe frustrated with the other things and just tired? So how do we differentiate that?
Okay, so this is one of the most important thing not routinely discussed. Okay, postpartum depression is the most common thing, like if we not treated well, and they will encounter very dangerous things. Okay, what exactly happens? How do you differentiate? See, many a times you'll be burnt out and you'll be like very tired. That way also depict like a depression. Okay, how do you differentiate is in the burnt out situation or when you're too tired, if you take proper rest, you'll be fine. Okay, the symptoms, aggression, and the things will come down. But whereas in a postpartum depression, that will not. It will persist. Even after taking rest, it would not settle. Okay. So, most importantly, I want to tell you how to prevent it. Okay. वो आने के बाद जाके रहने से पहले, firstly, you need to avoid it. How do we avoid it? Yes, postpartum period is very, very stressful period for the mother and the family. Firstly, we need a major family support, which plays a major role in avoiding the postpartum depression. So when the family support is there, you need to alternate. See, 24 hours में every 2 hours you have to keep feeding in there. It's really not possible without that continuous lack of sleep you will be having. There will be not even some 3 or 4 hours of continuous sleep which you will be getting that. So how you have to divide basically. If your mother is there or a husband is there, whomsoever is there, keep a breast pump, feed a baby once, and think who is the early riser or late night person. You just decide among yourself. Then pump the breast milk. For the next feeding, you give it to the husband or a mother, and then you rest for continuous stretch of 4 hours. So between one feeding, if the one more person gives, then it will be very much better. The stretch of 4 hours of sleep really matters. Or if the major support is there, a mother can actually take 6 hours of sleep also. It majorly matters. If the support is not there, then they are going to have a very difficult timings. That is one thing. Then why this happens? Yes, one is lack of sleep. Apart from that, in the pregnancy, throughout the pregnancy, the progesterone hormone is in full peak. Okay. Then suddenly it dips. The moment you deliver, the suddenly progesterone hormone dips. So obviously because of the hormonal imbalance, you'll be having so much. You tell some small thing, you suddenly feel like crying, or some small thing you suddenly feel like shouting. All these things keep happening. So you have to see if the symptoms are persisting for more than 2 weeks. Then you have to go and meet a psychiatrist. That's very, very important. And many times I have seen a patients who have little neglected during that postpartum phase. During that phase, if you delay going to the doctor, then they have ended up taking the medications for lifelong.
Oh.
I have one person known to me only. Her baby is now already 13 years, even now taking the antidepressants. If it's not treated at that time, if you delay going to the doctor, then long-term effects ho jayega.
Oh. So you said just 2 weeks after delivery?
No, not just 2 weeks after delivery. If your irritation is persisting for more than 2 weeks. So you'll be, small things, you'll be getting irritated. But if you take some rest and you get up, if you're feeling fine, then it's fine. But if you're feeling too low, not able, sometimes they'll be, the postpartum mothers will be so much, they'll not even able to feed the baby. They get angry to see at the baby also. So in that scenarios, it's always, if this is happening, the symptoms of these things are persisting for more than 2 weeks, they have to meet a psychiatrist.
Okay, so if 2 weeks these emotional burst is happening, that is probably okay. But if beyond that,
you have to wait.
Actually, everyone that I know who feels like that, they have definitely suffered more than 2 weeks. But yeah, probably it just got settled, or I don't know, like how they're handling that. So yeah, that's a very important thing that you pointed out. Okay, so when we talk about hormones, it is just a lot of ups and downs happening.
Ups and downs, yes.
Okay, and sleep is obviously one thing.
A major important thing, and nutrition. You have to eat properly. And yes, I forgot to mention this. So whether it's a normal delivery or a cesarean, whatever it is, they have to eat properly, protein-rich diet. Okay, many people, they'll be like, nothing, only little ganji or a little rice and with some powder, something like different customs have different things. But what I specify, you do follow your custom, but see to that any one small cut happens here. For that to heal, it needs all the protein stuff, everything. So whether it's a normal delivery, in the down we would have cut so huge, all the 3 layers, we would have stitched all the 3 layers. In the cesarean, yes, we would have cut in the 7 layers and we would have closed all the layers. So for that to heal, the nutrition matters a lot. Many people will not give importance to the nutrition. They will be like, nay, in our when we were delivering, it was like that only. So for our daughters, and it should be the same thing. Anta. Parents will be like stubborn. Whatever custom is there in our side, it should be followed. Anta. But they won't understand the importance of the nutrition, because that is, and the baby is completely dependent on the mother, not dependent on anything else for the nutrition. So they have to give the proper nutrition. I have had a patient where when I was working in a government hospital, I have had a patient wherein in that place the custom was, any person delivers till 1 month, they will be given only rava ganji. Nothing else, only rava ganji. So obviously, if we do 10 cesareans, 7 cesarean patients would come back with a cesarean wound open.
Seriously?
So common the wound open was, and how much ever we used to tell them and send, please give proper nutrition. They have this myth, rice if they eat, that rice will come out as a passanatara. So only rava ganji for 1 month. What nutrition will be there? Where will the proteins go from? How would it heal? So there was, for one of the person, they had given the thesis topic. Imagine the number of cases we had there.
Yeah.
So it's nutrition matters a lot. We have seen very bad cesarean wounds, and then dressing karo usko, alternate day dressing have to be done for 10-15 days. Uske baad resuture kar lo. So nutrition matters a lot.
Good that you pointed out about the thesis topic. So I talk about this every now and then, that people sometimes feels that whatever traditions we have, there was some secret or some magic, and science doesn't know yet. But this is exactly what I always say, that it's not that scientists or doctors are from some other world. They very much know what are the traditions, and there have been so many researches about so many things that are existing.
Every single thing, without the thesis, without the guidelines, we will not go.
Correct. And these things, it's not that customs and whatever things are there, they are not known to the doctors.
Yes, very much known. We have also come in the same families, so we very much know. But we should know what has a scientific evidence. We would try to follow that.
Obviously, even little bit merit, so nobody will say no to it.
Yeah,
absolutely. Okay, so postpartum depression. Firstly, that sleep must be taken care of. Nutrition should be good.
Plenty of waters.
I was expecting
and family support major, especially husband.
Yeah, true. I was expecting one more thing. I think even isolation, which is practiced at many places,
isolation, obviously they will go into major depression. No, isolation should not be done at all.
Right.
They need more socialization ideally, because they will be doing only baby work. They'll feel so depressed. If they sit and talk to people, they'll feel a little better.
So during my pregnancy, right, I had some complications, and I was on complete bed rest for around 3.5 months. That was the most depressing time. Even before delivery, right, it doesn't have to be postpartum. I think any individual, if they're just restricted to one room or something, that is so depressing, and that happens left and right,
Yeah, it's very common. We are seeing so many cases nowadays. We don't know. I mean, so many problems with the mouth of the uterus or short cervix, and so many scenarios we see. Some people will be having placenta previa, and that the placenta which has to attach up would be sitting on the mouth of the uterus. In that scenario, we cannot tell them to go out or travel, because it's completely very dangerous. A little movement also would trigger the bleeding.
Correct. No, which is whatever is important as per medical advice. I'm not questioning that.
Yeah, that
of course, that is important.
But during that time, obviously they'll feel too much depressed.
Yeah. But at least in postpartum, this thing should be fixed. We should be allowed. Must be encouraged to move out as much as body allows.
That is true.
Yeah.
I myself, when I was 3 months postpartum, I took my son and went for trip for Chikmagalur.
Oh, nice, very nice.
That highest peak in Karnataka is Chikmagalur ali. So there we had gone Mullayanagiri trek.
Yeah. I've also been there multiple times. It's nice. In 3 months only.
When he was 3 months,
Yeah.
and everyone there were like, "Oh, you small baby? Are you small baby?" Like, it's okay.
I think that should become a norm.
It should become normal. Yeah, that is not happening.
Yeah.
I mean, relatives only. One of the relatives, they said, the one person they came, a close person, one who was knowing. They were like, okay, I was going for on a trip, and that everyone knew, because after that I was going for one more additional course, wherein another 2 years, not even one day I could get a break. So because of that, my husband also, chalo, will go, he said. And then my relatives, one person was like, okay, go on. One more person, oh, you 3 months अभी जा रहे हैं, ऐसा कैसे हो सकते हैं, छोटा बच्चे को कैसे हैंडल करेंगे? वो रोज छोटे बच्चे को ही हैंडल करते हैं, उसको पता है, उसको जब फ्री मिलते हैं उस टाइम पे जाते हैं, रहने दो बोल के मेरी एक और रिलेटिव ने उसको बताया.
I can't imagine you getting this advice of handling a small baby. First one to touch the baby.
when he will be like, oh, you. And one more common thing which I get, I'll tell you. See, I myself had got, both my deliveries are cesarean. Okay. It's not that I jumped into, first one 13 hours we went through the labor pain. After like 13 hours of pain, my son's heartbeat started varying. And that moment we had to go for emergency cesarean. At that time when I was still 4 centimeter dilated, I cannot sit, nahi mujhe normally chahiye, baby ko kuch hone do, that we cannot say. So emergency section was done, and after that second one was planned section. अरे तुम भी डॉक्टर हो के तुम्हें भी सिजेरियन होता है क्या? अरे आई एम ऑल्सो ह्यूमन बीइंग. मैंने डॉक्टर को भी बुखार आते हैं क्या? यस, डॉक्टर्स आर ह्यूमंस.
करेक्ट.
सबको क्या होता है वो डॉक्टर्स को भी होता है.
So now that you have brought this topic of normal and C-section, so obviously this is the most Googled question when somebody is pregnant. So tell me, like, as you mentioned, right, being a doctor also, you had to go through it because that was the
scenario. It's that situation. Yeah.
So, but I feel so bad for the women who. Two types of women actually. So those who had normal deliveries, they will in today's world of content creation and all, right, they will have some videos like they say you had normal delivery, you were lucky to have it, and the luck is, and they are exercising in those videos. That gives a wrong message that just because I exercised I was able to get through it. And then there are so many others who also exercised, but they ended up in a C-section because of so many reasons.
Yeah.
And then there's a kind of failure feeling. All the relatives and all will come, and family, friends, everybody, and there'll be even questioning, taunting, and showing some mercy kind of thing. If not taunting maybe, but yeah, showing some kind of mercy.
Ayo, Papa, aapko cesarean ho gaya.
Yeah. So I mean, like, throw some light on it, that what are the things that exercise can do, what are the things that exercises cannot do, and just tell us more about it.
Okay, so this is very good question. So when it comes to normal delivery, yes, exercising is really one good part of it. I do encourage it. Okay, so I myself, for all my patients, first 3 months we would not tell anything because the placenta is still not formed and not very much attached, so we'll be telling basic walking should be enough. Okay, after 3 to 4 months, then they have to start doing the exercises and everything. The pelvic floor strengthening should be done. The exercises, they have to meet a physiotherapist who would exactly teach them the proper position. They should not trying to do the things on their own. What is proper position, how it has to be done, how many repetitions. Doing the exercise really helps a lot in case of normal delivery. That is there. But that only will not be deciding the normal delivery. The final decision maker will be sitting inside the womb. Okay, कैसे मुझे बाहर आना है? Decision maker. I always tell this to my patients. See, whether you or us, Even in case of 2 loops of cord around the neck also, I have delivered normally. So हमें स्कैन में पता था 2 loops था. We knew, we were continuously monitoring the baby heartbeat. So what really matters is at the time, see, if there are certain conditions like placenta is sitting low lying, or the baby's bumps are down, head is not down. In these scenarios, it's direct cesarean. Okay. Apart from that, everyone should give a very good trial of normal delivery. Okay. In case, but whenever we are trying any patient for normal delivery, throughout we'll be monitoring baby's heartbeat. That's why I said the decision maker is sitting inside. If the baby is comfortable inside, it will tell us through the heartbeat. It is a baby's way of communicating with us. Okay. When its heartbeat is comfortable, it will tell, yes, or kitne time chahiye, you can wait. Anta. If the heartbeat is comfortable, we'll keep waiting. There are certain scenarios, baby's heartbeat dips or it goes very high. See, normal baseline heartbeat of the baby is between 120 to 160. Okay. So, if the baby's heartbeat is dipping down, so when we see the baby's heartbeat race, we have the thing called NST, we call it as NST. Yes. So, we see whether the baby's heartbeat is accelerating. Though always when we see the NST, it should be like mountains. It should never be like valleys. When it is like a valleys, obviously the baby is telling, I am not comfortable inside, please take me out, I cannot tolerate this pain anymore. Okay, right. That is the baby communicating. Or as I said, if the heartbeat is maintained well, you can go through. There are certain patients, there is no loop of cord around the neck, nothing, but still the heartbeat, if it's uncomfortable, if the baby feels uncomfortable inside, it would tell us. Okay, and one more very much important thing, the baby, if the baby's head has to come down through the normal delivery, the chin of the baby has to touch the chest like this. Okay, when it touches the chest, the baby's head diameter here will be 9.5.
Okay.
If it goes like this, the diameter will become increased. 10 to 11. Okay. And when we do the internal checkup, we can tell head is there. Head is down. We cannot tell chin is testing here or here. That cannot be made out. So if the baby's heartbeat, if it's showing variation, that means sometimes it would have been like this and it's that compression it would have feel. So it would show it through its heartbeat. That is what happened with me. My son's head was like this. We call it as a deflexed head. That we can make out when we are doing cesarean, wherein we have to bend the baby's head, do the flexion and then take it out.
And these things obviously cannot be controlled by any sort of
exercise. Sort of exercises will not control it.
Right.
It is only the decision maker is always sitting inside. Neither the doctor nor the patient, it's the baby who decides how I have to come.
So doctor, another thing is when it comes to the normal deliveries, especially the episiotomy. So tell us, like, why is it required? Can the deliveries happen without that? The reason I'm asking it, that there are some issues related to urine or bowel issues, and I see many women are so afraid of episiotomy that they prefer C-section over it. As per my understanding, definitely C-section is a bigger surgery, but that fear is so much there. So is it, first of all, tell us that is it something related to only normal deliveries with episiotomy, or it can happen in C-sections also, and like how does the recovery look like?
Okay, so this is one most important thing. Okay, when it comes to the pelvic floor, the muscles in the pelvic floor, so why is the episiotomy required? I'll tell you. Episiotomy is nowhere related to urinary or bowel disturbances. Okay, it is nowhere related. Why is the episiotomy given? If the episiotomy is not given, we are going to end up with that.
Okay.
Okay, if episiotomy is not going, see, when we see the female perineum, above is a urethra, middle is a vagina, in between the vagina and anus is a perineal body, a muscle. Okay, and then comes the anus where we pass stools. Now, during the normal delivery, if the baby is, when the mother is pushing and stuff, if we episiotomy, what we do, if this is the straight line, we cut in the side so that our bowel is not disturbed. We cut in the side and we stitch in the side. Okay. So if we don't give that, some suddenly, if it cuts, then we end up in the anal incontinence.
Okay.
The anal incontinence is wherein they will not be able to control the passing stools. Without their knowledge, they will be passing the stools. Okay, so that may encounter. Okay, that is very annoying situation. What the female has to go through without controlling the stools, it's very difficult. Okay, that is the reason episiotomy will be given, so that we are going to save it, and proper perineal support also will be giving, because when the head, maybe head will be like this, no. When it is coming, it will push like this and come up. When it's pushing, obviously the anus is going to cut if you don't give if there is not enough space there, it's going to cut the anal area. Okay. That is the reason this is given. Episiotomy is very good thing. Okay. And if we don't give the tear which happens stitching that, and it will not come to proper anatomy. If you see the episiotomy given and the stitched, very nicely, it's like planned surgery and planned suturing. It will be very clean. Okay, all the 3 layers we stitch, we cut like this, whereas we stitch in 3 layers, mucosa of the vagina, inside muscles and outside skin, all the 3 layers we stitch it in. So later what discomfort, they'll be having pain for 3 weeks or 4 weeks. Most importantly, they're not supposed to sit in the cross legs. When they sit in a cross legs, the stitch might open up. Okay, so this is the importance of episiotomy. Now coming to the urinary and bladder disturbances which you were discussing. So urinary disturbance or bladder disturbance is it is not that it would not happen with a cesarean, it might happen also with cesarean, but it is pretty common with the normal delivery. If episiotomy is not causing this, what is causing that? You will be asking me.
Yeah.
So during the normal delivery, there will be that pressure, they'll be pushing down. When they are pushing the baby, yes, the vagina, anterior vaginal wall, posterior vaginal wall, they'll also be having that little pressure which might press this and cause a urinary incontinence, one thing. And that pelvic floor, no, it is like one basket kind, which is having the bladder in front, uterus in between, and behind will be having a rectum. So this thing, we have to strengthen the muscle. Okay, when to do the pelvic floor exercise? Not before 6 weeks.
Okay.
Till 6 weeks rest de do. It has to heal. What we would have cut should heal by on its own. But after that, they have to do Kegel's exercise. When they do Kegel's exercise, they are strengthening the muscles of the pelvic floor. That would prevent the urinary incontinence.
So it doesn't happen in case of C-section?
Very less likely.
Okay.
Not just this, one more important thing which I want to hear with the urinary incontinence and the anal incontinence, not just that, the vaginal laxity also will be there post-normal delivery.
Okay, but with Kegel's these can be improved?
It can be improved.
Okay.
Many people, they'll come with a very lax vagina post-normal delivery, but it can be very well improved. The urinary incontinence can be prevented, the vaginal laxity can get back to normal with the Kegels. When it's too worse, then in that scenario the treatments are there, laser treatments are there. But otherwise, first you have to try with the exercises. So that's very important.
So, but how would you compare this episiotomy versus the C-section?
Both are not, both are fine only.
Okay.
So
recovery time is...
Recovery time, it's fine.
Okay.
Not a great difference.
Okay. Thanks you for throwing light on the postpartum phase. That's the most ignored phase, I would say.
Yeah. Thank you for inviting me.
There were many eye-openers for me. I did not know a lot of things what Dr. Subrita has shared with us. If you enjoyed this conversation and would like to see more such, then do not forget to like, share, comment and subscribe to this channel.